Hello, my name is Jennifer Corbin. I'm a nurse practitioner student for Maryville University. I'm going to be conducting a focused head-to-toe exam. This is my volunteer, Curtis. First thing I'm going to do is check your acoustic nerve, which is your cranial nerve number 8. I'm going to do this by conducting the whispered voice test. What I'd first like you to do is place your left hand over your left ear, kind of blocking your ear, and I'm going to stand behind you and whisper something to you if you could repeat that back to me.
4J8.
Next, I'm going to do it on the other side, so if you could block your right ear with your right hand
Okay.
and repeat back to me.
3T9.
Excellent. He repeated those words accurately back to me. Next thing I'm going to do is called the Rene test. This also checks the acoustic nerve, the cranial nerve number 8. What I'm going to do is place this tuning fork on your mastoid bone, which is the bone behind your ear there. What I'd like you to do is let me know when you no longer can hear the sound that it makes. Next, I'm going to move that tuning fork next to your ear. Again, let me know when you can no longer hear the sound that it makes.
Okay. No. No.
Excellent. I'm going to repeat that same test on the other side here. Again, let me know when it no longer makes the sound, and then when I move it next to your ear, same thing. Let me know when it no longer makes the sound.
Okay. Now. No.
Excellent. And his air conduction was twice as much as his bone conduction, which is expected value. Next thing I'd like to do is check his thyroid gland. I'm going to look at his neck. I'm going to slightly have you raise your head there. I'm looking at his neck, and it appears symmetrical, smooth. I don't see any masses or swelling or fullness at the base of his neck there. I don't see any goiters. His skin is intact. It's good coloring. No discoloration, no redness, no swelling, no bruising. I'm going to have you swallow. Actually, here's a cup of water. Might make it easier for you. Take a sip and just swallow for me. And the movements appear to be symmetrical. Next, I'm going to palpate his thyroid. Curtis, I'm just going to place my fingers on your neck here. I'm going to place my fingers just below the cricoid cartilage, then move them slightly back so that I can palpate the thyroid gland, both lobes on the left and the right. They feel soft, no nodules present. Curtis, I'm going to have you take another sip of water and swallow for me. And I'm feeling for the movement of the isthmus, which I did, and it felt symmetrical. I did not feel any nodules. Next, I'm going to feel the lobes of his thyroid gland, and I'm going to do this by slightly deviating the trachea over to the left by slightly pressing with my right hand, and I can palpate that left lobe with my left hand, and I'm just going to slightly palpate that lobe. Curtis, I'm going to have you take another sip and swallow. And it feels soft, small, smooth, no nodules. Again, I'm going to slightly deviate the trachea to the right so that I can palpate the right lobe with my right hand. I'll have you take another sip and swallow. And I do not feel any nodules there. It's small and smooth. Are you having any tenderness or pain?
No.
Excellent. Okay, if I did note any enlargement of the thyroid, I would want to auscultate for any bruits. So I'm going to take a listen. I would use the bell of my stethoscope. First, I'm going to have to take a deep breath in and hold. And exhale. And do that again on this side, please. And exhale. And I do not hear any bruits. You doing okay?
Yep.
Excellent. Okay, the next thing I want to do is check his infraclavicular nodes, and I'm going to lightly palpate under the clavicular line there. And I feel his nodes. I don't feel any nodules, no swelling. Are you in any pain? Does this cause you any tenderness?
No.
No pain, no tenderness. I don't see any redness. And the nodes feel very small, soft, and non-fixed. So I'm going to repeat that on this side. Again, just lightly under the clavicle here. Any pain or tenderness?
No.
And the nodes feel small, soft, and non-fixed. I feel no masses or nodules. I don't see any redness. Next, I'm going to check his axillary nodes. I'm going to have you let me raise your arm. Just relax your arm for me so it's in a nice relaxed position. I'll support it. I'm going to palpate under his arm here, and I'm going to palpate the axillary nodes. I don't feel any nodules. I don't feel any masses. Do you having any pain or tenderness?
No.
Excellent. The nodes feel small, soft, and non-fixed. I'm going to repeat that on the other side. Just again, relax your arm. And I'll palpate under his arm. Any tenderness or pain?
Nope.
I feel no nodules. The nodes are small, soft, no nodules, no masses. I see no redness. Okay. Next I'd like to do is check your lumbar spine. If you could actually stand up for me. I'm going to move this chair to the side.
Okay.
I'm looking at his spine here. It looks straight. I don't see any exaggerated curvature. The lumbar spine curves slightly inward, which is expected. His skin is without any redness. I don't see any rashes or lesions or ulcers, no scars. I'm just going to palpate here. You having any tenderness?
No.
I feel no masses. Curtis, I'm going to have you bend forward and reach down towards your toes. Looking at his spine, it looks to be in alignment. His muscular structure appears to be symmetrical. You can stand back up. I see no kyphosis or scoliosis. I'm going to have you lay your arms to the side. Just relax your arms to the side and bend over towards your right. There you go. And to the left. And then kind of lean back by arching your back slightly backwards. Excellent. Stand straight up. Are you having any rigidity or pain?
None.
Any discomfort?
No.
He appears to have good full movement. I'm going to have you take a couple of steps forward for me, just like walking. Any difficulty taking steps?
No.
Okay, you can come on back here. His range of motion appears to be intact, and he's without any discomfort, and his lumbar spine appears to be straight. This concludes our focused exam. Thank you very much.